Good afternoon, everyone. My name is Nancy Deardorff, and I'm with Helping Seniors of Brevard, sitting in for our Executive Director, Carrie Fink. And I'm excited for today's show. We have an excellent guest. But before I get to our excellent guest, I just want to remind everybody what Helping Seniors of Brevard is all about. If you already know us, it's a reminder. If you don't, Helping Seniors of Brevard is a local nonprofit grassroots charity here in Brevard County, and we're dedicated to improving the lives of seniors here in Brevard County through information, education, resources, and connection. We survive based on donations, business sponsorships, bequests, and of course, our fundraisers. So thank you to everybody who has supported Helping Seniors of Brevard all these years. And we hope to have your continued support so we can together, we cannot do this alone, but together we can continue helping seniors of Brevard. And today we're focusing on home care, and I'm very excited and happy to introduce one of my favorite people and also a sponsor with Helping Seniors of Brevard, Carlos Cuesta, owner and president of Synergy Home Care of Palm Bay. Welcome, Carlos.
Hey, how are you today?
Good.
Glad
How
to
are
be here.
you?
Doing great, great. I'm excited to be here with you today.
Good to see you and good to have you here with us today. I'm excited to talk about home care as somebody who practiced as a registered nurse for over 33 years. I spent the majority of my career in home care. I have a hospital background, but home care was my passion, both skilled and private. I have experience with. But before we get into that, I wanted to see if you could share with our listeners, Carlos, share a little bit about your background.
No, my background. Thank you. I spent 39 years in human resources. So I have worked for some world-class companies around the country and did that, like I said, 39 years working with major corporations, where I built offices and work with clients, and I would hire employees, train employees, and put them to work. So when I decided to move out of the corporate world, I had looked at different industries. All kinds of industries. I went to franchise shows and I talked to a lot of people in restaurant business, ice cream, opening a gym, taxes. And then someone introduced this home care to me. And I looked into it and I liked it because it was very similar to what I've always done in my life. You recruit employees, you train them, you qualify them, and you place them to work. The big difference is instead of business to business, you're placing business to home. So now you're helping families, and that's what really intrigued me. So it's been 3 years, about 3.5 years now. So it's really, and the more I get into it, the more I love it. When we first got into this, myself and Anna, we talked to several companies within the industry, and we fell in love with Synergy only because Synergy is not the largest, it's not the smallest. It's like three bears, right? It's not the largest, not the smallest, but just the right
It's
fit.
just right.
That's right. And it had enough support, training, and caring and growing. I mean, we were just awarded for the 5th year in a row, fastest growing within our industry.
Wow, congratulations.
So that's amazing. Yeah, we're very proud of that. So yeah, like I said, we've been in this about 3.5 years, and every day I fall more in love with it. So we've helped all kinds of families, veterans and families of all ages, all throughout Brevard County. And that's my background. And it's my passion now, 24/7.
Well, you know what? This community is so blessed to have Synergy Home Care and you at the helm, because the home care world, I know, is very competitive and not all home cares are the same. And from the day I met you, I sensed your passion and I appreciated your passion for helping not only the clients you take care of, but their families as well. And Carlos, you're one of those folks. Helping Seniors is so blessed to have you involved with our organizations because you really do have a passion for people, whether or not they're your client. I've seen you time and time again go out of your way to help this community and be part of adding good, positive things in this community. So thank you for that.
Yeah, no, I appreciate that. Thank you very much. It means a lot. And that's why you're in the business, right? It's about caring for others and taking care of other people. Every day, right before sitting down with you today, right now, I just got a phone call from a referral. Hey, someone just referred me to you, Carlos. Can you help me and my dad? We're really looking for help. So in this business, to be successful, you have to have a heart. You have to care.
No
And
question. No
exactly.
question.
And it may not be your customers giving the best advice. And this week alone, I just referred a family to one of our partners. So I'm not getting any business out of it, but I'm referring them to somebody. I've done that 2 or 3 times this week alone. One for
Well, and
equipment.
you know what? That didn't mean to interrupt you, but that's what makes you uh you go above and beyond, and that's why I've seen you do that time and time again. And the name of your business is Synergy Home Care of Palm Bay, part of the Synergy family. But you have, tell me about what service areas that you serve in Brevard, because it's not just Palm Bay, although your main office is there, right?
Exactly. Yeah, our main office is Palm Bay, but as you know, we're part of helping seniors. We opened our office in your location, the Resource Center, which we're very proud of. We do service mostly most of Brevard, but mostly from a little bit south of Palm Bay up to the Vieira area. We do have some clients in Titusville and Cocoa, so we have been successful in those areas.
Right.
But again, we'll try to help any family. We'll sit down with them and see what their needs are and what we can do for them. And if we can't help them for whatever reason, we refer them to one of our trusted partners.
Right.
So we're in the business of helping other people. So let's work together.
Right. And we're so glad, Carlos, that although you've been a supporter of helping seniors of Brevard for years, this year you joined us at our Joe's Senior Resource Center of Brevard as one of our resident sponsors. So you have a satellite office here in Melbourne.
Exactly.
Yeah. Well, we're very proud to have you as part of our resident sponsor family.
And a lot of it has to do with you and has a lot to do with Carrie and the organization, helping seniors of Brevard. You do such good work and you're so dedicated and you're sincere about it and you appreciate sponsors. And I mean that from the bottom of my heart. That goes a long, long way. And it's growing and people see that and they want to support you. So that's why I'm there. I think it's a great partnership. And I want to continue that partnership. And I'm trying to promote you all the time, or should I say us now? But thank you for having us.
Well, thank you.
Our office there. Yeah.
We really appreciate that. And it is what it's all about. We want to surround ourselves with resources, businesses, and organizations that are trustworthy. Because we're a senior-focused business, it's important that when seniors call us for a resource such as home care, that when we give them resources, that is a trusted resources that will do right by folks. So we really appreciate it. And thank you for that. I can for certain say that thank you on behalf of our executive director, Carrie Fink, myself, Karen Warnland, and all of us at Helping Seniors. So thank you for that. Carlos, I wonder if you can, excuse me, if you can explain to folks, home care can be quite confusing. I know that for people that have not experienced home care or who aren't in the business, there's so many different types of home care. For instance, there's skilled home health that's covered by Medicare. There's private home care. And then under the umbrella of private home care, there's hands-on, non-hands-on. Can you kind of give an overall can you clear that up for people who may have no idea what home care is all about so that we can clear up that confusion between the different types of home care?
No, it's a great question because most people don't have a clue. And myself walking into this business, I didn't have a clue until you get educated. And it's pretty simple, but it is confusing at first. So first of all, you got to look at there's home health and home care. What is the difference? Home health is medical and it's skilled. Home care is considered non-medical, unskilled, which I don't like to use the word unskilled, but it is what it is. So you have home health, again, it's skilled nurses, LPNs, occupational therapists. Home care, which we are, Synergy, you have CNAs, home health aides.
What for our listeners, what is a CNA?
A certified nursing assistant.
Okay.
And they are licensed through the state of Florida because Florida is one of the most highly regulated states in the country due to the senior population.
Oh, you got that right.
Oh yeah. Oh yes, I can tell you about how we got our license there. But yeah, so it's CNAs that are going in or home health aides that are registered, I'm sorry, licensed or registered through the state of Florida. And
Okay,
then you have the two licenses. You have the companionship and you have the personal care. Companionship would mean someone that's coming in doesn't necessarily have to be licensed, but they can come in, provide companionship. Let's go to the mall. Let's go shopping. Let's watch TV. Let's play games. Let's do that. But it's hands
right.
off. They cannot touch the client. Then you got the
Right.
personal care.
In my experience with companions and homemakers, they're really for maybe some of the more independent folks in the
Right.
home that maybe can't be, wish not to be, or cannot be left alone. Maybe they have some mild dementia, or they need company, light housekeeping, medication, telling people it's time to take your
Medication
medication.
reminders.
But by state law, they cannot touch the patient. They
Exactly.
can't bathe the patient or anything like that because they haven't had the training for that.
Exactly.
Is that something Synergy does, homemaking and companion?
Right. And then yeah, that's companionship. And then we have the personal care license, which the CNA home health aides will come in, do the light housekeeping, the meal prep. They'll do bathroom and kitchen upkeep. But now with that license, they can also do the mobility, dressing, bathing, showering, helping them with
Right.
mobility guidance. That means hands-on.
So they
That's
can
a big
help get people
difference.
like out of bed in the morning and get
Yes.
dressed, get them
Yes.
breakfast, medication reminders.
Right. And
Um,
most of them have, background dementia, Alzheimer's background.
right. Help them
You know,
shower or bathe.
yep,
Yeah,
and get dressed and all that. So, and that's a lot of it because a lot of, for example, I just met a family this week, beautiful family, very professional, but they're not home between the hours of 10 a.m. and 7 a.m. I mean, 7 p.m., excuse me. So they need someone to be with their father at home. He
right,
does have dementia. He needs help with mobility, and they need somebody there who's dependable, reliable, 5 days a week.
right.
Well, so the person that's going and bilingual. So
Right. And that's another advantage you have.
yeah, exactly.
Um, and people don't realize how valuable that is because having practiced as an RN and having been uh, uh, in a situation where I was the caregiver for multiple family members who had dementia, one of the obstacles that families faced, I faced it myself for a little while, but luckily I was in the biz, so I was able to figure things out. But it allows families to work, to leave their loved one at home under the care of somebody responsible and trustworthy, where they can still go out and make a living. Because I know myself personally, I'm not poor, but I'm not rich. So I have to work for a living, and having in-home care for several of my family members really helped me go to work, earn a paycheck, and it also gave me a needed break. I would have home care, not just when somebody wasn't home, but if I needed a break to do my own thing, right?
Right.
Yeah,
Well, in this particular case, it's called the sandwich generation.
yeah.
But, there
Explain
has,
explain what that is to our listeners.
yeah, the sandwich generation is that you still have kids at home and you're still caring for a parent.
Right.
You're in the middle. So now you have your children, your parent, and you still have your job too.
So you're
So that's
sandwiched right between the two.
exactly. And they need a
Yeah.
break, like you said. And I actually have a family also that what they need us for is, hey, every other Saturday, we want like to take the family out. Can someone stay with our mom for 5 or 6
Right.
hours every other Saturday so they can get out and do things and be together?
Right.
Because it does bring some stress on the family a little bit when they can't get out and they have to take care of someone seven
Oh,
days a
no
week,
question. No, it
24
was
hours.
the
And
most stressful time in my life. I know that.
exactly. So it's also having a caregiver in there helps the relationship between the family members.
Right.
That's a big thing. And it's amazing how many times families come back and they give you a Google review and thank you. Thank you. I mean, this is really what we needed. And you've really come through for us. So we like that. And there's one more difference too in these home care. You also have two sides of home care. You have some that are registries, and then you have some that are agencies. A
Okay.
registry,
What's the
yeah,
difference? Yeah.
yeah. The registry is a home care company that their caregivers are 1099 self-contractors. So they are not employed by the home care company. They are 1099. So they have to get their own insurance, or workers' comp, all that sort of thing. They may
So,
have it,
so for
they may not
instance, a
have it.
nursing assistant or a nurse would sign up with the registry, so, but they're their own entity.
Right. Well, in this case, it'd be the CNA or home health
Yeah.
aide.
Yeah.
And they have to do their own taxes and all that sort of thing. In
Okay.
our situation, we are a agency, so all our caregivers are W-2 employees. So they are fully covered. They're fully bonded with liability, workers' comp. Anything were to go wrong, they get hurt, they are covered through our insurance policy. That's a big difference, and it protects the homeowner.
Right. Right. Thank you for that clarification. This is always a touchy subject sometimes when it comes to folks, but how is private home care? How do people pay for your services through Synergy Home Care?
There's a few ways. Number one, you would have private pay, which a lot of people do. Private pay means a credit card, debit card. That's one way. The next way would be long-term care insurance if they have a policy. And
Okay.
then the next way would be veterans, VA. We are approved VA provider. So
Okay.
if we're taking care of a veteran, we bill the VA directly, so that veteran has no money coming out of their pocket.
And I do want to talk
Yes.
to you more about veterans a little bit later in the show because I know you work with veterans a lot.
Yeah.
But go ahead, the third way.
And then the one more way, which it would be Medicaid. Now, Medicaid, we do not work with Medicaid, but if a family comes to me, I will refer them to a partner of ours that does accept Medicaid.
Okay.
Now, one confusion is some people have is Medicare. Medicare will not pay for home care. They will pay for home health.
Right.
So if someone calls, hey, will my home care, will my health care pay for this? The answer, unfortunately, is no. So it's only for skilled or nursing, but
Right.
not for unskilled, which we are.
Right. And I know a lot of times regular folks that are not exposed to the business can get sticker shock at the cost of home health. It's not shocking to me because I'm in the business, and quite frankly, I think it's extremely affordable for what you get. And thank God we have that. Can you explain how home care, particularly with Synergy, can be a more economical option than maybe going to a skilled nursing facility for rehab?
A lot of people look at that and they think it may be more affordable going to a skilled a rehab or a community, but it really is not, because what happens is when we sit down with a family, we put together what's called a care plan. So we can create how many hours a day, how many days a week to make it fit into their budget. For example, I have one family now. They had their mom in memory care in one beautiful community, nothing wrong, beautiful community, but she was spending about $7,000+ a month. She decided to bring her mother home. Now we're taking care of her mother 6 days a week, about 7 hours a day, and so now our customer has peace of mind and is saving about $2,000 a month.
Wow, that's a big savings, and
Yeah.
people don't realize that. Plus, I would be remiss if as somebody who was a nurse, I have to remind people of you're not exposed to certain things that you would be exposed to in a facility. And nothing against our facilities. We have some wonderful, beautiful, clean and well-run rehab facilities in this county. Indeed, we're blessed with that as well. But it is a place where people congregate. You have lots of people. So infection, the chances of acquiring an infection from someone else is much lower in the home. I mean, you can get sick, obviously, from a family member, but it's not all sorts of people in and out of the building. So that And you're in the comfort of your own home.
Comfort in your home where the person feels much more surrounded by their home, their loved ones, and they're getting one-on-one attention.
Right. Right.
Attention.
Exactly.
I
And
always call them,
you
they're the
can't beat
star.
that.
No,
Yeah.
they're the star of the show.
Yeah, they are. They
They
are.
really are. Yeah.
I know that's one of the reasons I went into home health when I did, because as much as I liked sort of the excitement and the acuity in the hospital setting, when I was introduced to home health, part of the reason I went in, I started in the field before I got into management, was because I drove to people's homes and it was one-on-one care. While I was there, it was just me and the patient and maybe the family. I didn't have the call light going down the hallway with, 6 or 7 or 8 other patients. So I know that's what attracted me. And
You
that's a
know,
wonderful thing.
it's amazing when a family member can pick up the phone and call us directly and get an answer right there and then.
Right,
Yeah, they
right,
may have to leave a message. They may get my voicemail, but I always call them right back. As soon as I get that message, I call them right back.
right.
Versus, let me check my notes. Who's the last nurse who checked in on them? We don't know. Boom. With us, you get whether it's a Saturday, a Sunday, or during the week or after hours, you get a direct
Right.
answer right
And,
away.
and Carlos, speaking of home care versus rehab facility, I imagine that if a person needs to go to a facility, and there are people who really have to go to a
Of
facility
course,
before they transition home,
of course.
I imagine that home care is the perfect option for that person when transitioning out of the rehab back home, right?
Yeah, a lot of our clients have come from a rehab into the home. Now, one thing to clarify too, we also help our patients while they're in rehab
Oh,
or
you
while
do?
they're in the
Okay.
community. Yeah, because many times a family member may be concerned about overnights. Will my mom or dad get up to go to the bathroom, or will they fall, will they trip? So our caregivers can actually sit throughout the night with them.
Wow, that is fantastic.
Yeah,
That is good to know, because no matter how good a rehab facility is, they have many patients
right.
assigned per certified nursing assistant, so they can't be everywhere at once. That's a great comfort. So a
Yes.
CNA could stay the night and maybe help that person get up and go to the restroom in the middle of the night if they needed to.
Exactly. So they're not waiting in bed, waiting for someone to come take them, or they already, excuse the terminology, soiled themselves. They're not sitting there for an hour or two until somebody
Right,
can come in and clean them.
right.
Or
Is there any special arrangement that a person, how would somebody in, or the family of somebody in a rehab facility go about getting private nursing assistant in the facility? How would they go about that?
same way as any other way. Just give me a call. We will do the home care assessment inside the facility. I've
Okay,
done many of those. We go in and we do all the paperwork right there and get to know each other. And then we assign a caregiver that is comfortable working in a facility. And then we assign them. And then one thing I do to personalize my service, I also walk on my caregivers, especially if it's nighttime after hours.
yeah,
Automatically, I walk on every one of my caregivers.
right. And I imagine that you inform the facility and communicate with
Yes.
the facility, right, for continuity of care.
Yes, of course. Yeah, we stay in communication. We share our notes. Any concerns that we have, we do share that with them. Yes.
Yeah, okay, so that's good to know. And I imagine some people that end up in a rehab facility probably had home care before they ended up in that situation, so they could bring their caregiver into the facility and have a familiar face.
Yeah, a lot of them like that. They enjoy having that same person with them. They already feel comfortable with them. They already have a trust factor. They have a good relationship, and that's what the family's looking for. So there's
Right,
no breakup in that. Because if they go into rehab, if they don't have that same person once they go back home, is that caregiver available or not? So we want to not, we want to continue the service throughout.
Right, right. Oh, and I want to talk more about the caregivers and how you select them too. So we're getting ready to take a break here mid-show. I'm Nancy Deardorff, your host with Helping Seniors of Brevard, sitting in for Carrie Fink, our executive director. Stay tuned and listen on for more of my great interview with Carlos Cuesta, owner and president of Synergy Home Care. And good afternoon. Welcome back to Helping Seniors Radio. I am your host for the day, Nancy Deardorff with Helping Seniors of Brevard, in for our executive director, Carrie Fink. And today we're continuing our conversation with Carlos Cuesta, owner and vice president of Synergy Home Care. Welcome back.
Man, good to be back again.
So this is such an important topic, talking about home care. And we've talked about a lot. So I want to clarify, I'm trying to ask questions that maybe I know the answer to, maybe I don't, but a lot of our listeners who may need home care right now or in the near future, to clarify for them what home health care can do for them and when it's appropriate, and of course, how to get a hold of you. You talked about the type of services that Synergy Home Care provides. Can you quickly, in our second half here, do a recap of that and break it down, like with examples of the type of different services that you provide?
Again, we do provide CNAs, certified nursing assistants, and home health aides that come into your home or into a community if your loved one's in the community, whether it's an independent living or assisted living, memory care. And in our caregivers can go in for 1 day a week, 5 days a week, overnight, 24/7, live in. So there's all kinds of situations. We will sit down with the family, create a care plan of what the needs are, specific needs. And all our caregivers, our CNAs and home health aides, are all licensed and certified through the state of Florida to provide care, which is personal care, which means hands-on, helping with mobility, dressing, bathing, showering, transportation to doctor's appointments, which is really
I'm so glad you brought that up. That is one of our top calls on the Helping Seniors information phone line that we get, is transportation, which is such a problem for seniors in this community. There are transportation options in Brevard, but very few. Let me tell you about a situation real quick. I got a call this is going back a couple of years ago, a lady who lived in South County, in Barefoot Bay, to be specific, down in that area. All of her doctors were in Sebastian on the Indian River County side of things. Her doctors, that's her pharmacy. And she had called us because she was interested in learning more about Space Coast Area Transit and their, transportation options. And I explained to her, and of course, Indian River has a similar transportation system for the county, but they won't go over the county line. So here you have somebody who lives closer to Sebastian than they do Palm Bay or Melbourne, that can't get transportation through Brevard County to Indian River, nor from Indian River County up to Brevard because of that line in the county. And I really empathized with her. So I wanted to ask you if you provided transportation. And the beauty is you could cross county lines, right? If you had a patient in South County whose doctor was in Indian River County, like, maybe Sebastian, north part of Sebastian.
Oh yeah, we do provide transportation, and we can cross the line.
Okay.
Not an issue. And a lot of our clients do take advantage. We just have a new family started with us 2 weeks ago, and that's one of the biggest points, because the daughter lives in New Jersey, the mother lives in Palm Bay by herself.
Right.
And we take care of her 5 days a week, and then 1 day a week she's got to go get some treatments at her doctor's. So our caregiver actually takes her every week, and it's a big peace of mind for the daughter.
Right, it certainly is. And you mentioned, of course, helping a senior bathe or shower
Right.
preparing them for a meal, getting them up out of bed or into bed if it's a nighttime shift, tucking them in
Right.
and
Our caregiver can go
such.
in, get them showered, dressed, and then take them to the appointment, and then sit with them during the
Right.
appointment if they like that. And then
And correct me if
spend,
I'm wrong, your
yeah,
caregivers can do medication reminders, right?
medication. They cannot give the medication, but they can give medication reminders. So we do take the list of medications that they have, what times that they're supposed to be taken, their strength and everything, so that they can do that. Yes, the medication
So they can
reminder.
say, Mrs. Jones, it's time for your blood pressure medication.
Yep,
Can they
exactly.
retrieve the bottle and hand it to the person?
They can do that, but they really can't open it or give the medication.
Right,
Yeah, it's really just a reminder. You have to
just
be
a
very
reminder.
careful with that. Yes.
Okay. And I think you mentioned this at the start of the show, so I think I know the answer, but for everyone who's just joining us or as a reminder, do you provide services for just the senior population?
It's anywhere from children all the way to senior level and anybody in between, because some of our clients have an operation, they need recovery, knee replacement, hip replacement. So it can be anyone. I had one client, he's only 35 years old. He hurt his knee. He had to stay in bed for a week. So our caregiver spent 7 days with him,
So really all ages.
all ages. And
Oh,
we also help with children. How about new moms? We can help with new moms as well.
oh, well, that's great to know.
Yes.
That's fantastic. Do you have, I know a lot of home cares have a minimum number of hours per week or per shift, per day, that you have to hire someone for, I think is the magic number. And I understand that. A lot of times somebody will call and say, I need 2 hours of home care or an hour. And the home care company will say, we have a 4-hour minimum. And that's because you have to be able to get a caregiver out, and not all home health aides or caregivers are going to go out for just 1 hour's pay. Do you have a minimum requirement?
No, we really try to be flexible with our clients. So again, there's no hard rule saying yes or no. It's a matter of sitting down during when we sit down and do the care plan. What are the needs of that client? And if it's less than 4 hours, we will take care of them. Um,
Wow.
so
And
we try to be
I've seen you
flexible.
in action. I've seen you in action, Carlos. I have seen you jump through rings of fire to make something work, not only financially, but hours wise and days wise to make it work. I don't know what your interview process is, but you must have an awesome interview process because you managed to find the most compassionate caregivers. That is your certified nursing assistants and home health aides that are so flexible, because I've seen you time and time again be able to work with your staff to make things happen, to make a care plan work out, even with different, or what some people would say, irregular schedules for people. So that's another thing that makes you stand out. And for our listeners, if you think I'm a Carlos Cuesta and Synergy Home Care fan, I am. Spent many
Thank you.
years in the business. I know the good, the bad, and the ugly. And Carlos Synergy Home Care is one of the best. And that's because of you. That is because of you and your passion.
Thank you.
Speaking of the staff, do you have, you touched on it before when we talked about registry versus agency. What are the most minimum requirements that you have before hiring or in order to bring a caregiver on board with Synergy?
Well, first of all, they do have to have their license in the state of Florida or their registration as a CNA or home health aide.
Okay.
For example, if someone calls us today and says, I've been doing this for 20 years out of New York, first question we ask, are you licensed in the state of Florida? If the answer is no, we can't put them to work. So they have to have that license.
Can you put them in touch with the resource where they could
Yes.
get, if they're moving, get their certification or
Yes.
registration here? Okay.
Yes, we help them with that. Yes, yeah.
So that's good to know for any listeners that
Yes.
know of a CNA or home health aide that you're hiring, I'm assuming. There's always a need for good nursing assistants. So whether you're local and looking for an excellent place to work, or you are moving from, or you've just moved from out of state, Carlos is your person. Carlos, I'm just going to stop for a minute so that I don't forget. How would a potential employee or a potential client or their family get a hold of you if they wanted to talk to you one-on-one and learn more information about Synergy?
The best way is my phone number is 321-340-3828. Again, 321-340-3828, extension 101.
Okay.
Or they can always email us at Carlos Cuesta. That's Carlos Cuesta, Cuesta at synergyhomecare.com. But the best way is always the phone number. And no matter
Right.
what time you call, that's our office number. If you hit extension 101, it'll roll right into my personal cell phone number, and you'll get me.
Yeah. And I like that you make yourself so available for folks. And for those of you listening, if you missed that number, don't worry about it. You just have to know the Helping Seniors of Brevard number. We can put you in touch with Carlos. And of course, Helping Seniors of Brevard is 321-473-7770. So back to the staff, what are some of the minimum requirements in addition to being registered or certified in the state of Florida?
Most of our caregivers have 5, 10, 15 years, but the minimum we require, at least minimum 2 years experience working in an in-home environment with a family. Now,
Okay.
with the process we put together, as I mentioned before, I spent 38 years in human resources. So a lot of that experience we brought over here. And really the magic happens with the process, but really Anna, my better half, she's the one who works the magic and does the matchups, and she's very good at scheduling. But the way it works, if a potential caregiver sees our posting on Indeed.com, they apply for position we have. From that moment, they will get a questionnaire with 12 questions. They have to answer the questions. If they answer the questions correctly, the licensing, their background, their experience, they go to the next step. The second step would be they schedule time with Anna where they do a Zoom call, and Anna will interview them for about 15 or 20 minutes. You get to see them. It is a Zoom call. And then Anna's going to qualify them. Do they have the background, the experience that she thinks they'd be a good caregiver for our agency? And then she'll send them an application, a link to fill out the application, and schedules them for a time to come into our office for what we call a full behavior interview that takes about an hour and a half. And what we're looking for is, do they come to the interview on time? Are they dressed properly? When they're with us, do they answer the questions correctly? Do they have the experience? But we also look for, what's very, very important, is do they enjoy what they do? Do they like what they do? Do they make good eye contact? Do they smile? Do they show us that they have a passion for this job, taking care of others? That's a big way. But experience is very important. That's key. But do they like what they do? And that's what our clients like about us so much. That our caregivers are very passionate and caring.
Right. And you also do background checks?
Well, first of all, with the ACA, right?
Yeah.
Yeah, the fingerprints are done.
For those who don't know, ACA is the Agency for Healthcare Administration. Those of us in healthcare love acronyms, and the Agency for Healthcare Administration is responsible for oversight of any home care program. So background checks are required, but also you carry workman's compensation for your employees, right?
Right.
So if they were to get hurt in someone's home, that employee is covered, which is very good, so that the homeowner doesn't have to worry about having someone in their house and getting hurt because they're covered through Synergy.
Right. So yeah, right. Absolutely. Thank you for clarifying that about the department, the ACA, what ACA stands for. But we also do the reference checks too. Where have they worked before? Were they reliable? Were they dependable? That's key. And then, as you said, they're fully bonded, insured. So workers' compensation is, if they were to get hurt, anything at all, we're responsible.
Right.
So anything that happens in the home, again, we're responsible. See, a lot of families sometimes think, hey, I can save $1, I can save $2 an hour if I bring someone from the outside. But what happens if that person gets hurt? Or what
Not worth it. No, I've seen it time and time again. They hire somebody like off the street that says, I can help you. And very, very often that does not work out the way the person thinks, just to save a couple of bucks. Yeah.
And a couple other things is, what if that person takes off for vacation or they're sick? There's no backup.
Right, exactly.
That's another issue. And one other thing that's really starting to pop up in the state of Florida, if that person stops working for you and one day files for unemployment and they put that family down as the employer, the state of Florida can come after that family for payroll taxes.
Right. And I always explain that too. When I was in the business, it's important for people to remember there's a reason that home health does cost what it costs because everything's taken care of. Liability, workman's comp, hiring, scheduling, replacing someone, like you said, if they're sick or on vacation, all of that's taken care of. You know what, Carlos, I could talk to you for a long time, but time's a ticking, and I want to get down because I know you have a huge passion for veterans. So I want to change the topic and talk to you about, tell us about what you do to help veterans.
I have a lot of veterans that actually come to me or their loved ones, and they say, "Hey, my mom or dad, they're a veteran or a surviving spouse of a veteran. We want to know about benefits. We don't know will we qualify? If we do qualify, how do we apply?" So I actually set an appointment. I go to their home, I'll sit down with them, and I'll try to explain how the process works. Would they qualify? How to apply? What form to fill out? So we actually go through the form. I actually show them a video. And then if they're not registered in the VA Health, how to apply for it. But if they are, how do we contact their social worker or their case manager? And many of them don't know who their case manager or social worker is. So we'll pick up a phone and we'll find out who that person is. And that's actually the best way to go sometimes because it speeds up the process. So if we find out who that person is, the case manager, they'll take our information down and approve them. Now, again, if they're not registered in the VA Health, and then there's a form called the 1010 Easy form that we get filled out and we send that in. And then once they're approved, we'll get a letter from the VA, and the veteran will also get that VA letter saying how many hours a week they're approved for homemaker services.
Right.
And from there, I'll set up the appointment. I go visit tomorrow morning. I have an appointment at 10 o'clock. We'll sit down. We'll do a care plan. She's qualified for 14 hours a week. Boom. The other benefit is called aid and attendance. That could be for the veteran or the couple or the surviving spouse of a veteran, where they can get a certain amount of dollars through a pension to pay for the services. And we'll teach them how to do that as well.
You know what surprises me? How many veterans out there don't know about the benefits that they have? So, of course, they don't access those benefits because they don't know that they have them.
Right.
So I always recommend to people, if I get questions from folks or when someone calls our senior information line, give Carlos a call because he can help you figure out what benefits you have and how to utilize those. But that's always surprised me at how many benefits some veterans have, and they don't know that they're there to use.
And no cost.
Yeah, and they don't know cost, right? At no cost. Yeah, exactly.
No.
Now, is a physician's prescription or a doctor's order needed for somebody to get care through Synergy Home Care?
I mean, once they're approved through the VA, no. So, I mean, we'll show them how to do that process and what information they need. So once they send it in, they can get approved. But once it's approved, I mean, we're fine and we just move forward with it.
And what about a non-veteran that wants just to hire Synergy? Do they need a doctor's order?
No doctor's order is needed.
Okay,
no.
Because you're not providing skilled nursing care, right?
Right, exactly.
Yeah.
And for the veteran, the key is they need to have at least 2 ADLs, activity of daily living needs. What is 2 activity of daily living needs? Maybe feeding,
dressing,
mobility, showering, bathing, that kind of thing. Yes.
Right. And I wanted to ask you before we go into our calendar events to remind all our listeners about how quickly can services start once someone contacts you to say, hey, I'm needing services. How quickly do those services typically start?
Within a day or 2. Yeah, a lot of it depends on our clients, how soon they set the appointment for me to come in, do the care plan. Once we do the care plan, normally within 1 to 2 days, we have someone already ready to go.
Right. And you know what, Carlos, this has been awesome. I learned from you. It's been a while since I've been in home health, so I learned from you. You helped keep me current, and I'm sure our listeners have learned from you. This show always seems to go by so quickly, especially when we have a guest like you, full of such good information for folks that are listening. Can you review one more time if people have questions or want to talk to you, whether they're looking for a job as a nursing assistant or whether they're looking to explore more about home health for now or for later to have that information? How do they reach you?
Yeah, the best way, again, it's a simple phone call and I can help them, educate them. And it's 321-340-3828. Again, 321-340-3828, extension 101.
Thank you so much, Carlos. Thank you for taking the time out to be our guest on Helping Seniors Radio. We really appreciate your time, and we do appreciate everything that you do for this community. This has been a very enjoyable show, and I appreciate it. Thank you so much. For our listeners, I want to remind folks of our calendar events coming up. We have several events. Events are always outlined in Senior Scene magazine, where Helping Seniors of Brevard magazine is the center section. And then in the back of Senior Scene, there is a calendar of events that are helping seniors related. The first one I want to mention is Helping Seniors is working, pairing with AARP, and we're having a artificial intelligence workshop, how to identify if something is AI. Has to do with fraudulent things, how to identify if something's not quite right. So AI workshop, that takes place on Monday, August the 4th, and that is at Zon Beachside. That's on Patrick Drive. For more details or to RSVP, and RSVP is required, you can give us a call at Helping Seniors of Brevard. Again, 321-473-7770. We also have a great car show coming up. Let me take a step back. Also pairing with AARP is having advocacy training. That is coming up Tuesday, August the 12th from 11:30 to 1. I think we have a few spots left, maybe 8 spots. So if you're interested in being an AARP advocate, training is taking place Tuesday, October 12th, 11:30 to 1, and that is at DHG medical office there off of Wickham Road, just south of Sarno Road. And that also is an RSVP. Feel free to reach out to Helping Seniors of Brevard for more information or to RSVP. We're having an excellent fun car show with our friend, Bill Antonetts, at Tide and Tonic. That's Tide and Tonic Restaurant in Indian Harbor Beach on Saturday, August 16th. That takes place from 8 to noon, and there are all sorts of, it's a very large car show with all sorts of classic cars, muscle cars, you name it. And also Helping Seniors of Brevard will be on hand with ticket available for our 9th annual car raffle coming up. Just want to mention one more thing. We're short on time, so Carrie will review the calendar more with you. And again, you can always call us or check out the back of Senior Scene magazine. But I want to take a moment to promote our 9th annual car raffle grand event. As many of you know, every year we've worked with Joe, our late founder, has worked with AJ Hires of Boniface Hires for years now, and he hooks us up with a car, and we have a car for raffle. And this year we have 7 cars. So the winner gets to choose their choice of one of the 7 cars, all from Boniface Hires dealerships, including Kia. We have Mitsubishi, we have their Chevrolet dealership, Dodge, Jeep, several different cars to choose from. And the grand event for this, for the raffle, is all coming together on Sunday, October 26th. That is Sunday, October 26th. That's 1 p.m. to 4 p.m. at the American Muscle Car Museum, which is not open to the public. Mark Pylock is kind enough to open that space for our charitable event. And this is going to be our best one yet. Not only is it family friendly, so for every adult ticket holder, 2 children under the 9 or under get to come in for free. It's family friendly. We're going this year for the first time, not the first time for a car show, but this time the largest car show that we've ever had. So we're going to have an outdoor car show, courtesy of our friend Bill Antonetz. And then, of course, inside, all the wonderful cars and memorabilia inside the museum. We're going to have excellent sandwiches from Buffalo Wild Wings to go, kids' activities, music, an extra bonus raffle before the grand raffle. And then, of course, at near the end of the event is going to be the grand drawing. I always say there are no losers in this, because every time you donate for a ticket, not only are you donating for a chance to win the car, but even if you don't win the car, it gets you into the museum and our grand event inside and outside on October 26th. It's family friendly. You get to enjoy that event. And bottom line is you're donating to a good cause. 100% of our donations stay right here in Brevard County to help our seniors. Tickets are $25 donation for 1 ticket, or 5 tickets for a $100 donation. And you can get your tickets at www.helpingseniorscarraffle.com, or you can give us a call at 321-473-7770. And we would, or any time we're out at an event, we have tickets with us. And stay tuned for more ticket pickup locations, which we will be announcing in the coming weeks, so that there's a place for you to get your ticket that's convenient for you. We really need you. We cannot do this alone. We survive off donations and sponsorships. So please help us continue the work of helping seniors. We appreciate all your past support, and we look forward to seeing you at our grand event on October 26th. That's it for Helping Seniors Radio. Thank you to my guest, Carlos Cuesta with Synergy Home Care, and everybody have a great rest of your day.